Welcome to A Stride Above podcast, where our commitment to excellence in equine health and athletic performance unites us. Join your host, Dr. Alberto Rullan, as we trot through the essential topics that matter most to you and your equine family members. With over 15 years of experience in equine sports medicine and rehabilitation, Dr. Rullan is dedicated to navigating you through the latest innovations and essential insights in horse health. Together, we'll ensure that you and your horses always remain a stride above the rest.
Hey, today we're going to talk about summer sores. The summer is approaching and Florida is very well known for tons of summer sores. But usually I have the question, what is a summer sore? Do you know what's a summer sore? Do your trainer know what's a summer sore? What's a summer sore? Most of us know what is a summer sore, but we forget that this is created by the fly egg. It is the opportunity that the fly takes to put an egg in any wound. Doesn't matter what it is. Could be the face, could be the arm, could be the forearm, could be the cannon bone, anywhere in the horse, the coronary band, anywhere in the horse, it can develop a summer sore. There's a small cut that it happens in the paddock, can happen in the stall, anywhere. The fly comes in, deposit a small egg, that's it, that's all we need, one egg, and then the body creates what we call a hyper reaction. What does hyper means? It means exaggerated, an exaggerated reaction to that fly egg. And then the body starts developing what we call granulation tissue. That granulation tissue goes blooming, sometimes looks like a red cauliflower. I hate doing medication, I hate doing wounds related to food because we kind of don't like to do that. But anyway, you get the point. So we get this red cauliflower coming up out of the leg, cannon bone, the face, anywhere. And you say that it's not healing. And then you put all kind of ointments on it, triple antibiotic, anything you can buy at the store. You go to the feed store, they give you medications, and you cannot heal it. Then you put a wound care, like a Band-Aid, you put a bandage, you name it. You do all these kind of things and it continues not to heal. Most likely, you're dealing with a summer sore. But bear in mind, it's Florida, and in other states of the South, we do have other things that could be. So this is where the vet is going to probably look at it, might be for sure it's a summer sore, might have to take a biopsy to see what it is. It might be something called pitiosis, common here in Florida. And they get managed quite different, okay? And they have a different prognosis. But here we're going to keep it at summer sores. So you get this wound that is massively creating this massive generation, is getting big or not healing. And you call the vet, and the vet is going to probably cut it out. And in the center, you're going to see a lot of fly eggs. So what the vet's going to do is going to try to keep digging until he or she gets all the fly eggs. Now, the trick is to get all the fly eggs. If we don't get all the fly eggs from the summer sores, the body of the horse is going to continue creating this massive accelerated healing reaction. Because what the body is trying to do is trying to heal, but too fast. This is one of those cases where the body heals too fast, too good. And then the inside of that wound heals a lot better than the outside. So it's like a race. The inside goes really fast, the skin goes a lot slower, and then it cannot come together. So what do we do after we cut them out? There are multiple options. We can do summer sore ointments. We could do several different creams that include healing, antibiotics, steroids, etc. Whatever your veterinarian puts on this wound. Now, some of these get quite big and quite uncontrolled. We are what we call a referral center here at Epic. So we get some of the ones that are really, really big, that have been under the care of professionals and continue to be out of control. So we put those in other treatment modalities, such as hyperbaric oxygen chamber, because the hyperbaric chamber actually increases the healing of that wound from the outside. How does it do that? Well, it'll increase stem cell production, decreases the survival of microorganisms, helps with the infection. If you want some examples of this, I encourage you to go to www.equinehyperbaric.com, www.equinehyperbaric.com, because you'll see a lot of real nice wounds that we use it and how it heals those wounds. Now, not every horse, probably 1 to 2% of these summer sores end up going to the hyperbaric. 90% of them get solved by you with what I'm telling you right now, with proper medications. Whenever you cannot solve it, then the veterinarian that goes to your farm will usually take care of it. Now, that top percentage that are really nagging, really bad injuries, those are the ones that come to us. We do surgery on them, take them to the hyperbaric, and 99 to 100% success rate to get them healed. If the summer sore is not healing, it could be something else. It could be something like a pythium, for example. Some people call it swamp canker. Very tough, and make sure that you know and you get the difference. So let's say we have this wound, we get it healed. Does it come back? What else can we do to prevent it? It is said out there that some horses are predisposed to summer sores. I used to have a mare that actually got them every year in the face, and no matter how much we did to try to prevent it, she got them. So some horses are more predisposed to it. The immune system has a lot to do with it. So we also use immune stimulants to help them out. And proper deworming. It is said that if you properly deworm the horses, obviously the fly eggs, which is a parasite, might die or not develop. Well, I have dewormed my mare pretty good, and she would still get those summer sores. So it does have to be done. It does work very well when you deworm them, but some horses sometimes need a little bit of extra care. Some horses are just a bit more difficult. Well, if you have any questions about summer sores, please do not hesitate to contact us. 352-307-3690. That's our phone number, 352-307-3690. If you have one of those nagging summer sores that won't heal, check out the notes. In our notes that go with this podcast, you will also find our contact information and the webpage, which is www.equinehyperbaric.com. I hope you learned something about summer sores. Thank you for being with us today. If you like our content, thumbs up. If you don't like it, let us know and we will adapt. You have a great day.